At this time, I'd like to begin and introduce Doug Jones, who is running for Health Board Trustee member. So let me turn the mic over to Doug.
Great, thank you. Appreciate it. I know I've got 7 minutes. I doubt that I'll take anywhere near that amount of time, but I appreciate the opportunity to speak and introduce myself, give a little background and why I'm running for the Platte County Board of Trustees for the Health Department. Again, my name is Doug Jones. I am a resident of, obviously, of Platte County. I've been a resident here for almost 9 years now. This is my second stint in Kansas City. I did follow my wife around the country as she completed her medical degree and residency, and we came back home. So Kansas City is our adopted home for both of us. We both grew up in the state of Missouri. I grew up in Jeff City. I've lived and breathed around public health my entire life. My father was in public health for his whole career, still continues to serve in public health arenas. And so I've grown up around this field. I've chosen a career that has a link to public health and to really employee health and safety. I'm the global director of environmental health and safety for W.W. Granger. And so that gives me the opportunity to serve my team members, my coworkers, with the best public and employment health and safety information that I can. And I would hope to bring that to the Board of Trustees, an opinion of a father of three, of someone who works in the business community, but is also a member of this community himself, and that lives and breathes and lives in this community along with the rest of the constituents. So this is my first foray or attempt to hold any public office. I probably am the less slick candidate, and no offense to any of the other candidates out there, but I don't have a website, I don't have a treasurer. It really is just a personal passion to get involved in my community and to have a voice, much like my fellow citizens around me. In the community, I do currently am engaged with the Police Athletic Commission, a nonprofit arm of the Kansas City Police Department based down on 18th and White. And we service young men and women of the community through public health opportunities, as well as after school and programmatic activities that support our community. And that really has started my drive for getting more engaged, more involved in my community. And this was a great opportunity to kind of take my upbringing, my professional experience, and my strong desire to be a vocal voice in the community. So with that, I'm going to turn it over. Like I said, probably the briefest you'll hear from any of the speakers tonight, but it is exciting to be a part of this forum. Thank you.
Thank you very much, Doug. And right now, we'd like to hand it over to David Park, again, Platte County Health Board of Trustee candidate.
Thank you, Marcus, and I appreciate the Parkville Living Center putting on this event. I think it's very helpful for the voters in Platte County to really gauge how they want to vote on April 6th. And I'll start by telling you a little bit about myself. In a few months, I will have been married 43 years and lived virtually all of that time in Platte County. I have a daughter, a son, and two wonderful granddaughters, one of whom is a cancer survivor and immunocompromised as a result. So the past years, she's kept us a little bit worried, but so far so good. I'm now retired, having been involved with the delivery of public services for over 35 years with the City of Kansas City, Missouri. I retired as the Director of Neighborhoods and Community Services Department, a department that had a $24 million budget and over 200 employees. There was a wide variety of programs operated within that department, including code enforcement, abandoned vehicle towing, building demolition. We also handled liquor permits, animal control, social services programs like Meals on Wheels. We handled grants like the Neighborhood Tourist Development Fund program, provided minor home repair and weatherization services. Even the municipal correctional institution or the city jail was within my department. Before I retired, the city manager asked me to get the Kansas City Land Bank established and operational. This agency puts tax foreclosed properties back on the tax rolls and in productive use. I worked with the newly appointed Board of Commissioners of the Land Bank and served as the first executive director to get policies and procedures established and to set up an office and begin operations. After the land bank was fully operational, I was ready to retire. As for my educational background, I have a Bachelor's of Science in Environmental Health from the University of Nebraska at Lincoln. This involves studying areas like air and water pollution, epidemiology, and general sanitation. I also have a master's in public administration from the University of Missouri of Kansas City. Pretty much sums up my background. Let me tell you why I want to be a trustee for the Platte County Health Department. First, it is a nonpartisan position, and for good reason. I want to ensure that the orders and regulations issued by the health department are based on sound, established science, and not to support one political party, platform, or the other. We've seen the COVID-19 pandemic become a political football this past year, and as a result, there's been extensive conflicting information disseminated through the various media. The danger of partisanship is it can lead to orders and regulations that unnecessarily restrict personal freedoms or that allow a disease to spread, causing unnecessary illness and even death. My experience has been in the delivery of public services in a nonpartisan manner. I know how to do it, and I want to help ensure the health department remains nonpartisan. And although the pandemic has received the most attention, there are many other programs found within the health department. For example, the department provides clinic services, including women's health care, STD testing, and immunizations. Have consumer protection services like inspections of restaurants and childcare and swimming pools. The department addresses environmental concerns and teaches classes on CPR, proper food handling techniques, and other areas. They handle birth certificates, death certificates. They establish food establishment permits and sewage permits. But all of these activities of the health department are for the purpose of protecting our health. Now, I can help ensure that all the programs offered by the health department are operating at maximum efficiency and effectiveness. I have experience with designing programs to accomplish objectives and establishing measures to determine if those objectives are accomplished and at what cost. So I will work with the staff to identify the areas for improvement within the health department. I also want to see an expansion of community outreach. I think it's a given that openness and transparency must be guiding values for the health department. But I want to see that public input is not just accepted, but actively solicited. That process leads to improved services and increased citizen satisfaction with the delivery of those services. So I may have beat Doug on being the fastest, but that's a quick synopsis of my background and why I want to be your next health department trustee. And I want to thank you all for your time and attention.
Awesome. Thank you very much, Mr. Park. We look forward to the question and answer section that will follow our speakers.
Very good.
So let me now introduce Dr. Jeffrey Kingsley. 1 second. Yes, if you can step up to the microphone. There you go.
I'm Dr. Jeff Kingsley. I was recently appointed to the health board about 3 months ago. I filled a spot that was vacant, and I've been involved in 5 meetings since then, and I've been very involved in making sure that we make the right scientific and medical decision making. I'm married. I have 3 children who've gone through the Parkville School District. I'm a pediatric physician. I've done fellowship training in infectious disease and pediatrics for 3 years. I did a year of pediatric critical care training at Yale University. I've done a lot of public health work in all that training as well. I currently take care of a hospitalist position where I take care of babies in the intensive care unit. I take care of pediatric patients admitted to the floor, also going through horrible deliveries, and also taking care of consultations in the emergency department. And my time on the health board, which is, like I said, about 2.5 months now, I've been involved in 5 meetings. And during those 5 meetings, I've been very involved in improving what we can for the businesses in this area. We've opened up the curfew from 10 p.m. to midnight. We've also were able to open up the capacities and allow restaurants to stay open later according to their needs. Both the owners and managers have been able to make that decision now. I'm the only person on the board so far that I've only been on for 5 meetings that have been actively sending scientific and medical literature to other board members. I've been actively finding updates in the CDC.gov website and passing it to other board members as well. I've been doing everything I can to make sure that all the decision making that takes place on the board is done through medical and scientific data-driven analysis. It's sometimes kind of difficult on the board to kind of get things done, but I think I've been pretty effective so far. I've also visited the Riverside immunization site. I don't know if any of you had a chance to do that yet, but we've got that up and running now, and it's a masterpiece. You guys have to take a look at that. I've talked to Mary Jo Vernon, who is the director of the health board, and I've also tried to get the emergency meetings set up. I know that recently the CDC has opened up that schools can now go from 6-foot distancing to 3-foot social distancing. And so we'd like to get that up and running as well to make it much more easy for the school districts to open up and be more effective for the students. CDC has also opened up, if people have been immunized, that they can have small groups without wearing masks and social distancing. And so I'd like to get that implemented as well. Anything that we do, I want to make sure it's scientifically and medically oriented, right? And so I'm doing everything I can to do that. So I need your vote, and I appreciate any help and support you can give. Thank you very much.
To be able to deliver it. So yeah, I think from a county perspective, since the vaccine is distributed at the state level through the state health department and through the state government, the county has the opportunity and the obligation to advocate on the behalf of their citizens with the State Department. And then, like I said, once it's here, make those methods available and accessible to the residents as easily as possible.
Yeah, and I will say, I think that the health department has done about the best they can, given the types of information that's been flowing through to them. A lot of it has been disjointed because of the lack of coordination at the national and the state level. Our health department's not sure what's going directly to some of the pharmacies, like the Walmarts and Hy-Vees, and those are coming directly from the federal government, or it's kind of bypassing our health department is what goes in there. Each county was faced with trying to start some kind of sign up database so that they could keep track of who wanted it, who needed it, what tier level they were going to be at, as opposed to having one central one. And then the state comes up with the Missouri Vaccinator finally to get at least one kind of coordinated there. I think the state's formula for distribution was faulty, and it should have been gone to the cities more quickly than it did, as opposed to the rural areas, which is been we all know the stories that have gone on there. That should have been done differently. We could work with our local legislators to kind of put pressure at the state level to improve the distribution in that regard. But I think our health, and it was just basically more coordination, maybe coordinating with Kansas City some more and putting that pressure on the state to get more come up our way. That would be my answer.
Okay, so I've been involved, like I said, for the last 2.5 months on the board, and basically what we've done is when the first vaccine doses are being rolled out, we were only getting maybe 100 to 200 doses a week allocated to Platte County. It got to the point where we were considered a vaccine desert. And so we had to change that quickly. So what we did is we started partnering with hospitals and also entrepreneurs in the community. And we've been able to open up the Riverside Immunization Center, which is a mass throughput center to allow thousands of doses to be given. I know we just vaccinated some of the Parkville school teachers so that we could facilitate opening up the school district on a quicker scale. We're having a National Guard massive vaccination event, I think, taking place on this Friday. So we're doing what we can to go from the hundreds into the thousands of doses to be given. I think the other thing that's going to be coming down the pipeline will be other types of vaccines for COVID, which will increase significantly the amount of doses that we can give. To answer the second part of your question, other aspects of the public health department, what can we be looking into? Well, we have the new building now that we need to get up and running on a grander scale. We're able to do smaller vaccination events at the new facility, but we'd like to open it up and start doing other aspects of public health, STD screening, any kind of WIC training that needs to be done, those kind of things. And so we're trying to get that building up and running. We just had the architecture engineer come in on the last meeting to kind of give us a kind of a rough guesstimate of when we think we can get the place ready to start working on the construction inside. It used to be a daycare center. And so a lot of those rooms have to be adjusted and adapted to fit obviously adults. So that's kind of where we're at.
Thank you all. We do have another question in the chat, but I want to make sure that all voices are heard. So feel free, if you have questions, to send them directly to me and I'll ask them anonymously for you, or you can type them in the chat. That being said, I'll go ahead with Lynn's follow-up question, which is understanding the limitations on what counties can actually do with the vaccine. Again, an additional question for the candidates. What about other priorities for improving the health department?
Sure. So again, I'll start in that order. But I think for me, my biggest priority is have a community voice in the health department. The biggest gap I see is I've lived here 9 years and had really no knowledge and no exposure to the health department outside of what happened over the last year. It's been pretty well silent in our community. And I think there's an opportunity to raise the public health awareness of the Platte County residents. I think there is an opportunity to really build on a strong community engagement, but really build on the desire for the Platte County community to be healthy, well informed, and not swing to the political pendulum, but to be really I'm struggling with my words here, y'all, but really to have a community voice and to have community partnership and not led solely by a select few voices.
Yeah, and the outreach, as I had mentioned in my presentation, is very important to me, to get that community awareness out there and to gather the input from the community as to how they feel like the operations are going, provide their input. They feel like it's working. Like Doug Jones said, I think that there was a lot of folks that said, wait, we have a Platte County Health Department, over the last year, and that we have elections for the board for those. The awareness greatly increased over the last year, but it has been limited more to what I think that the COVID situation is handling. And I've looked at the website. I think that it could be redesigned, some improvements there to be able to share information a little bit easier, make it a little bit easier for folks to navigate through it and learn more about it. And then you've just got to go out. I mean, my experience with the city of Kansas City, Missouri was working with neighborhood organizations throughout the city, ensuring that they had input into the kind of decisions that the mayor and city council were making and what kind of developments were going to be occurring in and around their neighborhoods. So public input is very important for me. It's just been part of what I've done throughout my career.
The two big things that I've encountered since my time on the health board. Number one, that we really need to start pushing scientific and medical evidence for making our decisions. In our meetings, I've been trying to use the research articles and CDC.gov website as the source of the information for why I want to push the things I do on the board. I also think one of the weaknesses of the health board is its lack of transparency. We have a nasty habit of slapping the agenda on the front door of the building and counting that as a notice to the public. And so I've been working with the staff that are working on the website to make sure more of that information is made public so that so that people from the community can be more involved in our decision making. One of the last emergency meetings we had, we did a public notice over the weekend, which according to the sunshine laws, you're really not supposed to do that. And so there were a lot of people that didn't even know we had an emergency meeting that opened up the capacities and such for businesses and such in the community. And I thought that was unfortunate. So to me, it's improvement in how we make our decisions, and also improvement in transparency.
Thank you all for doing a great job of keeping your answers concise so that we can move through more of these questions. I appreciate that. And it looks like Lynn also appreciates your answers as well. We have 2 more questions, but I'll ask them individually so that you can address both. What kind of advocacy has been done to improve the delivery of COVID vaccine to Platte County residents at either the state or federal level? And Teresa notes that she believes that we have underperformed significantly there. So we'll go in the same order.
Yeah, I think that I would agree with that. I'm not sure that I've seen any tangible signs of advocacy for more vaccinations. I think it's great that we've got a mass vaccination site that's set up, but at the state and national levels, I don't know that there has been much evidence of advocacy for Platte County residents. I think David hit it well talking about the rural communities. I know many Kansas City and Platte County residents that have driven an hour and a half, 2 hours away to get a vaccine.
Yeah, it would be interesting to see how many Platte County residents who have been vaccinated were vaccinated in Platte County, Missouri, as opposed to going outside the county, because I would imagine that more of them have been vaccinated outside the county than within. And I agree. I think that there can be more advocacy for it. I think some of our local state elected officials have done what they could. The city, which of course represents half of the residents within Platte County, has really tried to put pressure on as well at the state level. But it's, they're not, it hasn't been as effective as I would have hoped that it would be.
So I visited the Riverside Immunization Center today, and it was packed. And so I think the word's getting out more and more, and people are showing up. Going from hundreds of doses to thousands of doses, I think is a huge improvement. I've contacted Senator Luke DeMeyer, who is her state senator, and asked him better ways to improve access to the vaccines. We've looked into, like I said, partnering with hospitals. For some reason, hospitals have a different pipeline to the vaccine as compared to the public health departments. And so by doing looking for alternative measures to find the vaccines, I think has opened things up big time. So I think we're in the right direction. Like I said at the beginning, we were called the vaccine desert, and that was embarrassing. It's horrible for the citizens of Platte County and all that. So I've been working real hard, like making phone calls, working with Mary Jo Vernon, and then, like I said, trying to do what I can to improve access to these, not just hundreds of doses, but thousands of doses of vaccine.
Thank you all. The next question is, would you have any suggestions for improvement in transparency with the health department?
Yeah, so I think my biggest suggestion would be to be over communicated, and I think using social media platforms as well as traditional platforms to communicate decisions of the board, decisions of the Platte County Health Department, and being community advocates and really making things open for community involvement. I think one of the other candidates said well that historically it's been a posting on the wall and you hope nobody shows up, and things are kind of done in private, and I'd certainly like to see much more visibility of the health department, the decisions that impact our community.
And I think in addition to getting meeting notices posted, on the web, something like that. Today's technology with the email is tremendous, and you can have it in email. Sign up for email notifications. I've signed up for email notifications from the city of Kansas City, Missouri, for all the city council committee meetings, and anytime that there's an agenda posted, I get an email for it. So I don't have to go look for it. It comes into my email inbox. I open it up, I look at the agenda, see if there's something that I maybe want to go attend or put my 2 cents in on. And I think that we could take advantage of that at the health department, be able to get, not just meeting notices out, but other kind of information, because not everybody follows their Facebook, their Twitter, or Instagram, whatever they use. They don't follow it that close, or the notices get lost in their news feed of all the other ads and junk that comes through.
One of the things that I've done to try to improve transparency is I've been notifying the newspapers of emergency meetings and such, that at least they're able to get access to the meeting and find out what's going on, so they can relate that to the public. A lot of the meetings, like I said, I've only been to 5 meetings. I was just appointed 2 months ago, but most of the meetings that I've been involved with, it takes a long time for those minutes to get placed on the website. You may not even find the agenda if you're lucky. It's very difficult to navigate. I've actually worked changing the website around. One of the things that I thought was kind of disappointing is when it comes to COVID data, the actual numbers of people that had passed away in Casey Metro versus people that were in Platte County non-Casey Metro, that data wasn't there. And I said that's unfair to the community. They need to know what's really going on with COVID. And so that had been changed. They've actually been able to add more tabs to the website so that people can navigate it a little bit easier to find the data, but it's still difficult to find. Like I said, and the biggest thing, like I said before, was slapping the agenda sheet on the front door. I mean, this isn't the 1700s anymore. We have internet, we have all that stuff. So I was really upset with that. And so they promised that they would start giving those agendas much further into the future. Hopefully that continues.
Great. Thank you all again for concise answers. That helps us move through more of these questions. I will say we'd like to wrap up around 7:45, and I'd love to take a moment to have like some final remarks if we do. So that being said, I'll ask another chat question. Do any of the candidates believe it will be valuable to establish relationships with state government and relevant federal agencies so that when advocacy is needed, channels are open?
Yeah, I mean, obviously, I think partnership is key in any organization, whether it's private industry or governmental entities. And I think the less an entity acts as an island unto itself, the more change and advocacy for its constituents can occur. So yeah, I think for me, obviously, yes, there ought to be relationships first within the county, and then secondly with the city and the state that support the residents and cities of Platte County, because there are many, but there ought to be advocacy, partnership, and paths of communication to ensure that no one organization is acting on its own.
Yeah, I agree. The coordination and partnerships are vital. As I said earlier, too, that about half the residents of Platte County live within the city of Kansas City, Missouri city limits. So we need to coordinate with the Kansas City's health department. And Dr. Rex Archer and I worked together. I was a director of one department, he was director of the health department. So I know him very well. We've worked together for many years. And I think that would be helpful in ensuring or making sure that those doorways are open and that both ways we're able to help out there. And then not just the local elected officials, but making sure that there's communications with the state health department officials who are making the decisions or providing data, that we maintain or establish and maintain excellent working relationships with those individuals as well.
Myself and Mary Jo Vernon have been in contact with the state senators and such from a state level government. So we're getting them involved. One of the biggest things that I've noticed, and it's another disappointment, I think, is the fact that we were supposed to be in great contact with other entities across the Casey metro area. And every time that like the mayor or other counties had made a change, there was no heads up, there was no communication. It was a complete surprise to us when these things happened. And we were told multiple times that we had to be in not so much lockstep, but definitely showed unification with the other areas to make our decisions. it turns out that everybody took care of themselves and didn't worry about other counties and other such. And so I made it a point in the last meeting to state that I think we need to start being more and more concerned with Platte County itself, including KC Metro Platte County, as opposed to worrying what other counties might be doing. Whenever there's new updates from the CDC, or if there's any updates from from the Infectious Disease Society of America, that we ourselves need to have our meetings and implement those. And if other counties want to follow us, that's up to them. But we need to put Platte County citizens ahead, and we also need to continue to have close contact at the state level.
Great. Are there any other questions from any of our participants? Well, hearing none, I figured we could go ahead and just do a quick lightning round and maybe recap some of the highlights or address things that other people have said. But we'll go ahead. I noticed that we keep ending with the same person. If we want, we can switch it up. If you're happy with this order, we can go in this order. It's perfectly fine with me.
If David or anybody wants to speak, I'm willing to give up the first line. But no, I think, like I said when I introduced myself, I mean, this is a little bit of uncomfortable territory for me. This is not I don't normally kind of put myself out there as far as public service visibly goes. I've been behind the scenes giving support and advocacy, but really felt over, like I said in my intro, over the last couple of years, and as a resident and getting involved with a couple other community organizations, that I've reached the point in my life where I need to be a more active member, and for me that felt more natural and most natural, both with my personal line of work as well as what I grew up around. What my wife is a physician. This is really a passion of multiple generations in the Jones household. So this is it's an exciting opportunity, and really appreciate the Parkville Living Center having this forum and the opportunity to one, get to know the other candidates. David, I knew you. You actually had a campaign event a couple doors down from me, and we met this last fall, and so I've known about you for a while now, and I appreciate your long-standing public service, and Jeff, it's good to finally put a face to the name as well.
Well, thank you. I want to echo Doug's compliments for the Parkville Living Center for putting this together. And not only putting it together, but it's actually, I think it was run very well, which with the technology and having folks in person at the same time, done a great job. I think in highlighting what I would bring to it is my years of experience with delivering public service programs and what that entails, at working with the public on helping it save tax dollars. I made many programs more efficient during my time with the city. I think it could easily save millions of dollars a year through efficiencies that were achieved during my period of time and my experience there. And that's what I would want to bring the health department, looking at all the programs, improving the outreach, improving the transparency, and the delivery of all those various programs and services.
I was appointed to the board, like I said previously, 2.5 months ago, and I'm the first physician that's been on the board for almost 10 years now. And so I think having a physician, if not more physicians on the board, would be very helpful to Platte County. Understanding all the nuances of immunizations, knowing all the nuances of COVID, I think is very helpful, and having a medical background is essential. So I would like to continue to use my medical expertise to help the citizens of Platte County. And once again, I agree with everybody else here. The Parkville Learning Center has been very helpful in getting our messages out and having us introduce and meet each other. And thank you very much for allowing me to have this opportunity to do this.
Well, thank you all for being here this evening, the candidates and the participants. If the candidates could stick around for one more second after the participants leave, but just as a reminder, the next one will be advertised on Parkville Living Center website and also Facebook. Thanks for coming. You guys can press the room button at the bottom, and there isn't anything in the main room, so you can just head on out, Jill. It was nice to see your name here. Doug, I mainly for the recording, I just wanted to apologize for not capturing your first response at the beginning with the recording. So wanted to give you the opportunity, because I do believe Marcus is going to try to post these for people that maybe weren't able to attend. I didn't know if you wanted to go back and touch and just kind of recap your answer for that first one, just for equitability, if you'd like to do that, because I didn't capture your full answer, and I apologize.
No, it's quite all right. And I really feel like that first question was less of a question about Platte County health policy, but how vaccines are distributed in general. So I'm actually perfectly fine not having a response in the recording. It'll be fine.
All right. Well, thank you all. You're wonderful. And I wish you all the best of luck.